Fall risk in young neurological patients. As previously noted, most published studies have concentrated on fall risk in elderly neurological patients. However, young adults can also develop various neurological conditions, yet research on fall risk in this population remains limited despite its clinical significance. This gap is concerning for several reasons. First, young adults with neurological disorders often experience a complex interplay of physical, cognitive, and emotional impairments. Given their younger age, they may face an elevated risk of falls over a more prolonged period compared to older adults. Second, because young adults are typically more active, engaging in work, sports, and other dynamic activities, their exposure to fall-inducing situations may be greater. Additionally, long-term use of medications such as corticosteroids and antiepileptics can further increase their susceptibility to fractures. A systematic review of fall risk factors in young neurological patients found that approximately 50% exhibit an elevated propensity for falls. However, inconsistencies in methodological reporting across studies hindered direct comparisons between populations or the identification of distinct fall patterns. The role of physical impairments, such as muscle weakness or sensory deficits, as predictors of falls also yielded conflicting results. Nevertheless, robust evidence supports the association between poor balance, gait dysfunction, and increased fall risk, consistent with findings in older neurological patients and healthy elderly individuals. The review emphasized the multifactorial nature of falls, involving both patient-specific and environmental factors. It concluded that young patients with gait or balance impairments, as well as those with moderate to severe motor disabilities, are particularly vulnerable to falls. Notably, even relatively independent and physically active individuals may face heightened fall risk due to their lifestyle.